Hello and good afternoon, good evening and good morning, wherever you are tuning in from in the world today. Welcome to another special episode of the AJ Roberts Show. I'm AJ Roberts as always, and today I am joined by none other than Dr. Richard Fleming from the United States. Dr. Fleming, thank you for joining us this evening, our time, this afternoon, your time. I appreciate you're a very busy man and getting a lot of interview requests. It's absolutely delightful for you to join us today. Thank you.
It's my pleasure to be here. Thank you, AJ.
Now, guys and girls, for those of you who've never heard of Dr. Fleming, he is a bit of a big deal in the world right now, especially when it comes to the medical side of things. And he is exactly that, Dr. Richard Fleming, MD, PhD, JD. Dr. Fleming, would you mind giving us a bit about your background, just for the context for the viewers, so they can understand like who you are and what you do, please?
Right. Well, in brief, I'm originally a physicist. I got recruited very early on in life, much sooner than most people would ever get recruited. It's kind of an advantage or disadvantage, depending upon how you want to live life. Way back in 7th grade, at the same time I was doing what most 7th graders are doing, I got pulled into a doctoral program that had been organized by the JFK administration back in the early 60s. Clearly, this was not the early 60s. It was later in the late 60s, early 70s. But my original degree is in physics, and eventually I ended up going to medical college, medical university. I'm a nuclear cardiologist, which is a cardiologist dumb enough to take more training. And then I have a law degree. I joined American Heart in 1976 as the youngest faculty member, which did a few things for me. It placed me on several committees. One was the committee that taught people how to do chest compressions and breathe for them, what's called basic cardiac life support. And then another one called the advanced cardiac life support, which is where we make the protocols for which drugs you get and when we put tubes into people and all of that. And then the third one was the physician cluster education faculty. And I began talking about that in 76, and with a couple decades of doing that and doing research on heart disease. In 1994, I came up with a new theory for what caused inflammation or heart disease, which was inflammation resulting from a number of factors, not just cholesterol, but a number of other factors, including viruses and bacteria. And so that was the first time the theory had been introduced, showing the role that viruses can play producing this inflammatory thrombotic response or inflammation and blood clotting. It's really designed to kill off the virus, but it can also cause harm to the person in some cases, particularly when not treated, like it hasn't been. And that's what COVID-19 is this inflammatory thrombotic disease. And then in the late 90s, early 2000s, I began making changes to a number of the imaging tests that we had and developed a patented method that is called the Fleming method, or FMTVDM, or a variety of names, that measures what's happening inside the body, and it measures metabolism and regional blood flow, and that allows you to find out what types of health problems somebody might have, be it heart disease or cancer or infections like SARS-CoV-2 and COVID-19, and it allows you to then treat people and measure the treatment response. So when 2019 hit, I guess I was primed for this type of event, although it certainly wasn't what I was planning to do in 2019. And then in early 2020, I sat down and went through a ton of research that had already been published. About a third of which I've put on the website called FlemingMethod.com. There's 142 papers under the virus material, and that's about a third of what I used to develop the research protocol. And then I did a research study, and the further I get into the research study and the better we got at defining what treatments worked and which ones didn't, the further I got into the investigation of SARS-CoV-2 and where it came from, and here we are today.
So one would say you're a little qualified to talk on the matter, which is absolutely fantastic, and why I was really keen to get you on the show. As I mentioned in the previous emails, and what I was saying to the audience, is I'd really like to strip stuff back as a little bit as I can to make it as basic and for people to understand. Because what I found, I have gone so far down the rabbit hole myself, and speaking to so many doctors and nurses and scientists over the last few months, so that I personally have as best understanding as possible for me. What I understand many of my family, friends, like, don't understand. And a lot of the big words or scientific words that one might use just basically turns people's heads the other way. So then they don't listen and don't really want to pay attention. They just want to bury their head in the sand and just crack on and just kind of hope for the best, I guess. And that's the kind of impression I'm getting from the general population. And the conversations I've had with people in the States, Australia, Canada, very much a similar pattern. So going back to 2020, obviously this is when it first really kind of blew up. And I knew that personally there wasn't something right when people started body popping on the floor in China and it looked really fake. That's when I started really questioning stuff straight away, and then started speaking to other people who felt the same. Other people thought, oh my God, you know, virus. Here in UK, we had a lockdown in March. People were very much in it together, and it was good, you know, it was very, very good. It was like everyone was united. People were helping their elderly neighbours out for getting their shopping, etc., etc. So it wasn't bad. It was only as things progressed and it started getting very, very draconian, and it was just wrong on all levels, on so many different departments, not here, just here, United States and different states in America, as you all know, and other parts of the world. But obviously this started from somewhere. Now, you've analysed and assessed very well, on great detail, Dr. Fauci's emails, and you did a big presentation in Texas recently about it, which is, you know, and really picked it apart. For the benefit of the viewers and the listeners, would you be able to just explain briefly who Dr. Fauci is, and at this early stage what he actually implemented, which has kind of been a big part of where we are now in terms of the Wuhan lab leak, the mask wearing, obviously the push for the experimental vaccines that we're seeing on every doorstep pretty much now. If you wouldn't mind unraveling a little bit of that so that the viewers can really get a good understanding of it.
Sure. So when I was in medical school, I would say that's when I first became aware of Dr. Fauci, because in the early 80s when I was in medical school, that's when HIV hit the scene. And that's about when Dr. Anthony Fauci became head of the National Institutes of Allergies and Infectious Disease, which is one of the branches of the National Institute of Health in the United States. Obviously a great source of money and funding. Researchers like myself constantly apply for some of those grants along with other grants, but you know, sometimes wherever the money goes, there's catches that go along with that. And if you look at the course of Dr. Fauci's career, for several decades, he's been not extremely successful at treatments for these infectious diseases and extremely interested in vaccines for these infectious diseases. Again, not very successful in them. In the late 1990s, the United States really kind of turned a lot of attention towards something called gain-of-function research, which is gain of function is the ability to take something that is an infectious agent like a virus and either make it more infective or more deadly, harmful, or a combination of those. The premise behind that is good. It sounds good. Is if you could stay a step or two ahead of something going on naturally, then you might be in a very good state for preventing it from spreading and becoming a pandemic and killing people, harming people. The problem is that if you look at what's been going on since the late 1990s and the funding that's come out of the United States, even during times when gain-of-function research was locked down and not allowed, you can track tens of millions of dollars coming out of the National Institutes of Health, the National Institutes of Allergies and Infectious Disease, Department of Commerce, USAID, the Department of Defense. More than half from the DOD actually going to Peter Daszak at EcoHealth, who then connected that money up with Ralph Barrick at the University of North Carolina and Shi Zheng Li at the Wuhan Institute of Virology. And if you have trouble connecting the pieces, all you have to do is follow the paper trail. And that paper trail is a list of grants that have been provided by these agencies to Daszak and others. You can look at the published papers with the names of Daszak and Barrick and Shi Zheng Li in one form or another together. You can see how they have actually published studies on gain of function for changing viruses to make them more infective. You can follow the trail of patents, both U.S. patents and international patents, including the one that I think is the most damaging, which is the one that shows that NIH actually gets royalties from a patent that Barrick has for gain-of-function research for spike proteins of coronaviruses. So it's hard to say you don't do gain-of-function research on spike protein of coronaviruses when you have a patent and it says that it was paid for by U.S. federal monies, and the U.S. government gets those patents. So for, my kind of aha moment is when I watch somebody like Anthony Fauci, Dr. Anthony Stephen Fauci, sit in front of Senator Dr. Rand Paul under oath and say, we don't fund gain-of-function research. It's like, you guys really should talk before you go into these meetings, because you need to get your ducks in a row. Yeah. If the stupid cardiologist can figure it out, then, other people can too. Sometimes, I'm taken back a little bit when some people, I've seen some people critique some of my evaluations of the vaccines, where I extract from the emergency use authorization documents the actual number of COVID cases diagnosed in people that are vaccinated and not vaccinated. And their comments are, well, where did he get that? Well, from the emergency use authorization documents, guys. If you'd read them, you'd get the same numbers. Well, he's not an immunologist. No, I'm just the guy who developed the theory. So, yeah, if those are the arguments against written documents, you're in sad shape to really kind of win this argument, because it very clearly shows that Fauci has been instrumental in getting these monies to DASAC. And even during the time when gain-of-function research wasn't being done, technically, it was still being circumvented around to Peter DASAC, which provided a nice non-governmental way of getting that money around. If you look at the published papers and you say, well, who's connected? What you find is that the people that have been doing the research on this gain of function are the same people that have been interfering with the medical treatments being provided, are the same people that have been developing the vaccines and doing a number of other questionable activities in their life. It's kind of hard for somebody who's maybe beyond second grade to have difficulty putting the pieces together. Now, a second grader might have challenges with it, but I've known some second graders that could put those pieces together pretty easily too, and it's pretty damning. It's just a matter now of holding them accountable, and it's a matter of getting a handle on it. And yeah, I mean, there's people out there that actually say viruses don't exist. I mean, and these particular individuals, I don't know. I guess they're still living in the 1700s, particularly when they want to know whether Cook's postulates, which is what we use for bacteria, have been applied, and where I would argue that, well, reasonably they have been for this virus. This is a virus, it's not a bacteria. You have to do certain things to get viruses out of cells, and if you don't understand that, you shouldn't be confusing the general public by saying, well, viruses aren't real. That is not your answer to this pandemic, which, by the way, isn't even a pandemic anymore. It's an endemic. Yeah. So,
would you have said on that? Would you have said that it was a pandemic at any point? Because obviously, I've witnessed the fallout of a pandemic in Sierra Leone, where with Ebola, very, very serious, and it's going to have lasting effects, even on top of obviously the civil war they had there. But at any point, from your professional opinion, would you say that this was a pandemic?
Oh, absolutely. When it first started to spread across the planet, it was a pandemic. It was an uncontrolled infectious agent that was a pandemic at that point in time. It quit being a novel. I love it when they pronounce it novel. It quit being a novel coronavirus back in probably March or April of 2020. It was no longer novel. It was here. It was, yes, it was gain of function produced virus, but there comes a point in time that you say, well, if it's all over the world, it's no longer novel. And once it's all over the world, well, then it's kind of endemic, isn't it? Pandemic is when it's spreading from place to place. By the way, In 2007, the National Science Foundation paid for a research project on what do you do if you think you're going to have something that's going to become a pandemic. And the answer to that, paid for by the National Science Foundation, was you shut down international travel immediately. And the reason why I bring that up is that the head of the NIAID would have definitely been aware of an infectious disease paper funded by the US government that was done at Indiana University, Paris, in Italy, that says shut down travel. So it raises the question of why, when asked back in early 2020 what to do with something that you think is going to be a pandemic, the question would be, or the answer would be, well, don't shut down travel. I mean, for Fauci to say that, you know, either he's unaware of it, which is bad if you're in charge of NIAID. Mm-hmm. He didn't understand it, which is bad if you're in charge of NIAID, or something else. And it doesn't matter which one of those three choices you choose to pick. None of the three are really good choices.
Absolutely. Obviously, the conversation we had in quite a lot of depth with Dr. Jane Ruby when she was on the show a couple of weeks ago was to do with obviously the Wuhan lab leak. But a lot of the conversation we went into with herself and Dan Gregory was on the actual isolation of the virus itself. Now, from your experience and your research and everything else like that, have you seen anything that suggests that the virus has been isolated?
Absolutely. Originally, way back, they had 5 patients, you know, and I have on my computer now, I think it's 98 or 99 genotyped viruses from all over the world, from China, from London, from Minneapolis, from Dallas, multiple from the cruise ships. All over the world. I mean, the way that we know that variants are going on is because you put the genetic pieces together. It's just, you know, apparently the people that think viruses don't exist think that exosomes are viruses. And exosomes are, for your listeners, cells communicate with each other through a variety of mechanisms. They talk back and forth between white blood cells, which are called interleukins, or between white blood cells, interleukins. There are chemicals that are released from cells that kill. So cell-killing messengers are called cytokines, cell killers. Exosomes are packaged material from one cell that are released that go and travel to other cells with information. But exosomes are not viruses. Viruses are something that come from outside of the body, and there's a variety of those that are basically wrapped in a system that can contain genetic code that require other cells to help them reproduce themselves. So they invade cells, they find a host, they invade cells, they release their genetic code, they make replicas of themselves, and then they're released as a packaged unit, and they spread. And when you're working with viruses, you're typically taking cells out of somebody. So, for example, with SARS-CoV-2, most of this is coming from the lungs of people. So we put tubes into the lungs and we flush it with saline, saltwater type solution, and then suck it back out, and that's called bronchoalveolar lavage. Going in the bronchus, the big airways, the alveoli, the small airways, and lavaging or washing, and you take those cells out and you treat those cells because you want to prevent any infections from contaminating the source. You need to open up the cells and get to the genetic material. And then the genetic material comes out in bits and pieces. You know, you're not going to get a whole string of a virus genetic code that way. And then you sequence those genetic pieces together, much like you put the pieces of a puzzle together. And when you're done, you go, well, there's the puzzle. That's what the picture looks like. This is what it is. And I mean, that's how we did the Human Genome Project. You know, when we looked at the DNA of humans, we had to take it bits and pieces and overlap those to see what it really is. And nobody's doubting that we have the DNA of humans, but we would doubt that we have the mRNA of a virus. I mean, that's just nuts. Yeah. So it shows that you don't if you're thinking that way, and I get it. I mean, it's not, everybody's not a virologist, immunologist, or specializing in that. That's okay. We all do different things. But for people to claim that they have an expertise in this area and then to say this isn't real is very misleading and very harmful, because all that does is confuse the discussion, and then it's easy to shoot that down, and anybody who calls into question about the development of this virus or the treatment of this virus or the vaccines now becomes subject to criticism because of the nut jobs that are out there saying viruses don't exist. They don't have the scientific expertise, and they shouldn't be interfering in a discussion on that. I mean, you wouldn't come to me and ask me how to invest your money, right? Because that would be foolish, right? I mean, you'd go to somebody who knows what they're talking about. I'm not somebody who's an advisor specialist. So, well,
if you said invest in Pfizer, then I'd
well, if I were Anthony Fauci, I might say that.
Yeah. And this is a classic. Obviously, we've got a number of these specialists here in the UK who are all over the television, get loads of airtime. And one notably today, I saw on a chat show, Dr. Hillary, for those of you who know, I don't mind calling them out. He sat there on live TV and just lied one thing after the other. Like even somebody who's not a scientist or hasn't got a PhD in science has spent enough time studying this to clearly see that everything he was saying was a complete lie on TV. The only problem is, if you complain to Ofcom, which are the people who are supposed to regulate all this nonsense, they're all on the payroll as well, and it's clear and obvious from the Imperial College and from the British government, along with the media. This has all been proven here in the UK, and I know you guys have a similar issue over in America and in Australia now, even more so, as Jamie McIntyre pointed out at the weekend. And in Canada, again, another place which is heavily sort of scrutinised with it. One of the biggest issues, or the biggest fraud over this whole thing, has without doubt got to be the PCR test, because the PCR test has been responsible in every country that are involved in this, crippling economies, closing businesses, depression, anxiety, suicide rates, abuse, all up through the roof, ridiculous amounts of isolation, and everything else negative that comes with it, all because of this one test. So I wanted to kind of strip that back, and if you wouldn't mind, explain what the PCR test is and what it doesn't do, if you don't mind.
Sure. Well, to begin with, I'm going to start by saying the PCR test is a very good test. Okay. I mean, Kerry Mullis is the last person before me to really take on Fauci, and he's dead now. Kerry Mullis developed a test to look for genetic sequences. And what you do is you take a sample and you have you basically have what's called a forward primer and a reverse primer. So the forward primer basically says start looking for the genetic base codes beginning with this. And if you find that, start replicating. And then you get to the reverse code, which is the end. And it says, when you get here, stop replicating. And then you put basically a fluorescein component in there, because every time you replicate that, as you replicate it, then the fluorescein will set off a signal. And this is a yes-no test that basically just detects the fluorescein, okay? So you double it, and then you double it again, and you double it again. Now, if you go and read Mullis's patent, it very clearly states to stop at 20 cycles, because at 20 cycles, you have got everything that you're looking for, and anything else is just garbage. So Kerry Mullis patents a test that's extremely useful to look for genetic sequences. That's what it's for, to look for genetic sequences. So when people say it doesn't look for a disease, no, that's what I thought doctors did. You know, we take a test and we look at a patient and we make a clinical diagnosis, and we go, you have high blood pressure, hypertension, you have coronary artery disease, you have COVID-19. COVID-19 is basically when you have the virus and now you have an inflammatory thrombotic response, which is just further in the program, I suppose. But here's the interesting thing. The emergency use authorization that sits in the U.S., and I think it must be around the world. The fourth requirement is that there's no treatments. And if there's no treatments, then you can bypass all the safety mechanisms and rules, and we just go to emergency use authorization. Doesn't have to be proven. So what happened was a perfectly good, outstanding test, the PCR test, was used and abused by cycling it up. I mean, at 20 cycles, that's more than 1 million replications, okay? So by the time you get to 40, we're talking just astronomical numbers of junk. That's not diagnostic of diddly, okay? Diddly squat, as my parents would have said. It's completely meaningless. So you have people in our government, and I think around the world, telling people, okay, there's no treatments, you can't treat it, don't treat it, so that we keep EUAs in place, emergency use authorizations. Now we're going to use PCR as an emergency use authorization test, which means quite clearly they're not following the rules about how it's supposed to be done, so that they can justify an emergency use authorization vaccine system. So they used and abused the test, did not use it correctly. This Mullis is got to be turning over in his grave, because he didn't do anything wrong. He actually developed a good test, and his test has been used and abused, and now most people think it's a bad test because the people in power either couldn't read or didn't want to read and just simply wanted to game the system. And of course, people just didn't know what they were doing. So, you know, no doctor uses a test to make a diagnosis. It's coupled with other things. So the idea that PCR, a single test, would tell you, yes, you have the virus, you have the genetic sequence. Great. That doesn't mean you have a disease. It doesn't even mean you're infected. It means you have bits and pieces of the virus particles. And if you ramp it up to 40, you'll probably find it on just about everybody. Now, it's nice that they rolled it back down for the vaccines, because of course if you do that, then of course fewer people that get vaccinated will be positive with the disease, right? Mm-hmm. Because, you know, well, you've rolled it back to where it's supposed to be. FYI, if you go through those EUA documents and you do the math and you say, where there's statistically fewer people who ended up with COVID if they got vaccinated versus not vaccinated, you'll find the vaccinated group have fewer people, but not statistically different. There's no statistically significant difference between whether people get diagnosed with COVID or whether they got vaccinated or not with any of these vaccines. So the EUA documents themselves tell you the vaccines do not provide a benefit. What they do is they reduce symptoms. Even Fauci has admitted they don't prevent you from getting infected, because the goal of a vaccine is to prime you so when you get infected, it will take you less time to respond, right? Mm-hmm. So it reduces symptoms. Here's an FYI for your viewers. So does aspirin and Motrin.
Who wouldn't have thought? Okay. And yeah. this is the problem. Obviously, I know that the World Health Organization, I believe it was the same day that Biden was inaugurated. Is that correct? Said, "Oh, you need to reduce the cycles which the PCR tests are being reduced at," and then they suddenly started getting funded by the United States government. However, here in the UK, there's been hundreds upon hundreds upon hundreds of freedom of information requests put in by a lot of people who have been rightly questioning things themselves, all around the country, to hospitals, medical centres and places like that, where PCR tests have been determining like what's going to happen for this individual, whether they can't go to work, their child can't go to school, their businesses are going to shut, all the rest of it. And every single freedom of information request that I've seen has said that they've been operating the PCR test at 40 cycles and above the entire time. So since last February, or whenever they came into circulation. Would you say that on paper that is a crime?
On paper, I'd say it's stupid. Crime is so my lawyer hat goes on and says, well, a crime is what the jury decides is a crime, Right, okay. And as long as they get the evidence, as long as it's not hidden from them, they can actually make an intelligent decision. But frequently you go to court and the case is decided before you go to court, and things are hidden from juries, and sometimes intentionally so. So, you know, what is a crime is that this is a biological weapon. It's in violation of the Biological Weapons Convention Treaty.
What makes it a biological weapon? Because obviously I know it's a word I've used, especially in the last couple of weeks. It's been I've seen it on your presentations. I've seen it on I've seen Dr. Jane Ruby mention it.
Right.
I haven't actually seen anybody in the UK mention the term yet. However, there's a lot of doctors and physicians in the United States and other countries using the term.
Right.
What defines it as a bioweapon?
Right.
We're talking about the vaccines, or
the
the actual disease itself has been leaked.
So first off, the virus is a bioweapon, okay? And it's harder to say that the vaccine is a bioweapon, but what you have to understand about the vaccines is that they're carrying the same genetic code, basically, that has been altered to make the bioweapon, right? And when you analyze the vaccines, which we've done, Pfizer and Moderna, and you look at them, their genetic code of the vaccines don't match the genetic code of the virus. What they do match is the biological weapon part, the prion-like domain region.
Wow.
And so, I think that's fascinating when you look at everything else and it's up and down and not matching, except for where the prion-like domain, which is the area on the spike protein. There's a couple areas actually on the spike protein that produces prion diseases. So those are abnormally folded proteins that when they come into contact with other proteins form diseases like mad cow disease or Alzheimer's disease or things like that, which are what the animal models have shown. And there's enough people already symptomatic with neurologic diseases and then the inflammatory thrombotic diseases that, you know, this is only going to get worse as we develop these. So clearly the virus is a biological weapon. It's a gain of function that was produced that has no benefit to people, that is harmful to people, that was intentionally produced. That's the definition of a biological weapon. You just have to go look at the Biological Weapons Convention Treaty, and it very specifically tells you, and there is no excuse for doing that. All nations recognize that we don't do that. Mm-hmm. And if you do that, it's a violation of the Biological Weapons Convention Treaty, and that's a big no-no, you know, in legal terms. It's a crime. And the vaccines are emulating that, and they know that it's emulating that because they're making the spike protein, and the spike protein is the bioweapon.
And in terms of that, obviously you've got governments, agencies, pretty much everybody, every man and his dog, going, pushing some kind of coercion onto the general populace to say you need to get this vaccine. Obviously, they're telling people to and priming people to go and get something that is actually not what the actual virus is of. Like you said, it's actually bioweapons.
Well, it's an experiment, and so as Kevin McCarran, who's a neurobiologist in Japan, has frequently said, and I agree with him, you're in the largest, you're either in the experimental or you're in the control group right now. Either way you look at it, you're in one of those two groups. This is, we have never before quarantined the healthy. We have never before refused treatment to the sick. I mean, even the conventional treatments of aspirin, heparin, bronchodilators to open lungs for people that are having breathing problems, we've never refused that before. We've refused that. We've never coerced a population to be vaccinated. Even in the 1970s, when I was an orderly and I took care of Guillain-Barré syndrome, neurologic disease patients who'd had swine flu vaccines, 25 people died, and they said in 1976, okay, that's enough of that. We're over 9,000 in the U.S. and is it 12,000 in Europe or something like that, known deaths. And those are the known deaths. I can tell you, I've called into the physician number for the vaccine adverse events reporting system, VAERS, and I get a recording. Not a voicemail to record. I get a message that's pre-recorded. and then it gives you another number. So when you call that next number, that number does the same thing. There's no place to leave a message. It's just a message itself. So if you're a physician in the United States calling in, there's no way to leave that in. I've talked to physicians who've tried to electronically send in adverse events, and it gets kicked back out. There's also in the United States, so I'm sure unfortunately the UK and other countries have this same bureaucratic mess. You have to mark down codes for what you're billing a patient for. In this country, it's called, in the US, it's called an ICD-10. We're up to the 10th version of it. And if you look in there, because you have to put one of these down to justify why you're seeing a patient, doing tests, doing whatever, there are codes, ICD-10 codes for adverse event to measles, mumps, and rubella vaccine, adverse events for influenza vaccine. What there is not is a code for adverse events to SARS-CoV-2 vaccine. You can't code it. There's no computer record to keep track of what's going on. There are codes for patient refused the vaccine, patient did not comply with the vaccine, and 3 codes for patient didn't have access to a vaccine, but not a single code for patient had adverse event to a vaccine. So there will be no record of all the people that have come into hospitals and doctors' offices with an adverse event, because there's no way to leave an electronic computer record.
Just making it ridiculously difficult for something that is actually very easy.
It's making it completely impossible. Yeah. All you need is that second grader to come up with 1, 2, 3, 4, 9, 7, 8, and you've got a code or whatever they want to do. Yeah.
I'm not saying that, obviously, clearly not every physician and doctor is like this at all. There's lots of good ones out there, but it seems to, in every country there's clearly an agenda. There's obviously, they know something. So when people are coming to them with these reactions, they're telling them to basically get a grip, go and take some paracetamol, do this, do that, and trying their best to not make any link between them at all. And I'll give you an example. I've only spoken to a few people about this. It's only happened yesterday. So I went to the chemist yesterday, and the gentleman in front of me was asking for some kind of antihistamine because his whole left hand was swollen. I mean, like almost the size of his twice the size of his right hand. I was like, that is weird. He explained that he said he asked about paying for his prescription because he's actually been in the military for 30 years, so full career in the military. So he was clearly like an officer or something like that. He then said he'd never had an allergic reaction to anything in his life. And the lady pulled him over, and I could hear everything they were saying. And she asked if he had any inoculations recently. And he said, yeah, I had my first COVID jab on Friday afternoon. And then this is yesterday, so Sunday morning. He said he phoned 111, which is basically like, instead of going to the emergency room, it's a number to call to basically do a bit of a triage. They told him just to get some, he said, they told me to come and get some antihistamines because I might have been bitten by something. He was very distressed.
Big mosquito.
Yeah. There's loads of them here. He was very distressed, obviously, as you can imagine. Said he couldn't hardly feel his hand at all. And she asked him what arm he had the inoculation. It was the same arm, same shoulder. I don't need to be a mathematician to put 2 and 2 together. I don't need to be a doctor to see, to diagnose that man. And you could clearly see her face was like, oh my God, what do I do about like upsetting all these people here? Because they could hear everything. That's happening all over the country. That's happening, I know where you are, same in Australia. Like these doctors and physicians are refusing to put like any links between the two. And as I mentioned before, I was at the march in London a couple of weeks ago, and I was really keen to speak to all the doctors and nurses there because there was hundreds of them. There wasn't just a few, there was hundreds of them there refusing to be part of like this whole shenanigans. A lady I spoke to works in a London Borough Hospital, very busy. She said that they've not had a single COVID patient the entire time. They've tried to label everybody in the ICU as COVID patient. However, the ones that they're having there now are just pretty much all elderly people with bacterial lung infections caused from wearing masks all day. And they've got a 400% increase in heart attacks, strokes, blood clots, all under 40 years old and all double vaccinated. Every single one, not even like just the odd random person who isn't, every single one. I think that's very alarming. I genuinely do. And I think personally it's a huge crime if the people who by their oath swear to firstly do no harm are doing completely the opposite, no matter where you are in the world.
Right.
And that obviously leads us on to, the huge issue now, which is scaring a lot of people who are unvaccinated, which is the big subject of shedding.
Right.
What's your personal expertise and research on what you've done on the so-called shedding issue? Because a lot of people are getting extremely alarmed about it, and it is, the government are already trying, and the media are already trying to cause a huge divide in every country between trying to get people who are vaccinated to, almost prey on the people that aren't and disown them.
Right.
But from the other perspective, we've got this issue.
Right. Well, the first question anybody should ask is shedding something that's real? Right?
Yeah,
is it possible for somebody who's been vaccinated to somehow affect somebody who isn't vaccinated? And if these symptoms, let me just play devil's advocate and play it out as a scientist. If these symptoms are real, then the question is, what is it that's really being moved from one person to another? Is it spike protein? Is it lipid nanoparticles? Is it the adenovirus from the injection? Is it genetic sequence? Is it because they're nuts? Okay, I mean, play it off the full spectrum. Is it by touch? Is it respiratory? What is it? And the first thing to acknowledge is we don't know what it is. But there's clearly something that's happening. And during that June 5th presentation in Dallas, I shared during that 5-hour time zone some of the documents that the FDA and Health and Human Services in the United States released in August of 2015, which was a guidance to the industry on what to do with mRNA and DNA, what they call gene therapy shedding. That's their document. So my first response is, if this is not a real phenomenon, the United States FDA and Health and Human Services went to a lot of effort, a lot of time, a lot of money to put together a document in 2015 to tell the industry what to do when they're shedding from mRNA and DNA what they call gene therapy products. Okay, so I mean, it's not my term. It's again, as a scientist, I go, well, I still like to call it a drug vaccine because it has to clear the FDA, and it's clearly not a food, so it must be a drug. But independent of the rest of that sequence, I mean, those are their terms, not mine, right? And I obviously didn't coerce the FDA and Health and Human Services to write that document. What you can also see is that there's great research that's been shown on what's called SAMs and transmissible and transferable vaccines. So what SAMs are self-amplifying mRNAs. And way back in March, when I started doing some presentations here in Dallas, I said, I don't think these vaccines, if all they're coding for is the mRNA of the spike protein, I don't think there's enough genetic code in these vaccines to get this type of immune response, which means something has to be coming from earlier in the genetic sequence in open reading frame 1A or 1B, namely the genetic information for the replicase enzymes to make more, to replicate, to increase the amount of the spike protein made. And that's what you call a self-amplifying mRNA, or a SAM. And if you look at the papers that have been published, that you can see in these SAMs, these self-amplifying mRNAs, that cause this increased immune response, which is what we're seeing, this inflammation and blood clotting in people that are getting the vaccines, because they're getting much more than they would by person-to-person transfer of the virus. If you look at all the viruses that are being studied, it'll tell you what the virus is and how they're getting into the body and what they're trying to get reproduced and what animal model it's being tested on. And you can see that for HIV and rhinoviruses and a bunch of other things. And then you'll go to SARS. And the animal model being tested for self-amplifying mRNAs is human. Okay. Now, again, not my paper, not not my published research paper. So is that what's being spread out? You know, good question. Are we? Is it a transferable or transmissible vaccine, which is just simply the difference between injecting or putting a paste on somebody for a vaccine? And the animal model, by the way, that they've tested this out on the most is the bat. So you know, so it's kind of like you can't make this stuff up. You just read the papers, find the papers, read them, and go, did they think nobody was going to go do a literature search? You know, and I don't know. I mean, there's not a lot of us that are really catching on to this stuff. So maybe they were right in thinking that people wouldn't do it. But, you know, if you tick off a Viking long enough, we're going to come hunting you down. And, you know, that just happens to be in my bloodline. So it's like, you know, you ticked off the wrong guy. You ticked off somebody who knows what he's doing, who's got Viking blood. And then there's other very good people. I mean, again, Kevin McCarran in Japan, Luc Montagnier and Jean-Claude Perez, both in Paris, Li Men Yan, who's the virologist from Hong Kong, who got out of there and has been presenting information to people about what she knew of the virus and what the people who trained her knew about SARS-CoV-1. I know Anthony Fauci is listening to what I have to say, because I've been using the term SARS-CoV-1 for some time, referring back to 2002, because if this is SARS-CoV-2, then clearly the first one has to be not just SARS-CoV, but SARS-CoV-1. And when Fauci was being interrogated by Rand Paul in the Senate, Fauci actually used the term SARS-CoV-1. And that's the only time he'd use that term up until that point in time. So I think he's paying attention. I think he's, you know, he's paying attention to the fact that people are calling him out and exposing this. The question isn't whether Fauci's going to be held accountable. The question, I think, is who Fauci's going to throw under the bus.
Yeah. Is he that kind of person, is he? Let's hope so.
You know, when you're looking at an international criminal court, if you're not the guy in charge running it, and you're one of the people, you know, still up there but doing it, you might want to consider telling the truth.
and this is the biggest point, and why I've taken the shift with the podcast I have and had the people on, and why my good friend Dan Gregory has done way over 250 broadcasts on the pandemic podcast here in the UK, is to try and give the populace, whoever's watching, the truth, because that's what everyone deserves. Everyone's life's been turned upside down at the expense of these so-called elite and their big agenda. So from a majority, you know, absolutely everyone deserves the truth. So, you know, he needs to be held accountable, 100%. Just like the people here are totally complicit here in the UK, within our own government, you can clearly see that they're merely puppets in this whole thing. You know, there's people far higher than the government that are basically running this show. I watched a good interview with René Formeisch, who's running with the so-called Nuremberg Trial 2.0. He believes there's a lot of evidence that points to about 3,000 of these so-called elites involved. Everything from the Rockefeller group all the way through to your Bill Gates and everybody else like that. So, I mean, I think people want to see something happening about all this sooner rather than later, you know, and I'm sure we all do, and I'm sure you do as well, Dr. Fleming. What do you see happening in terms of, because obviously you're doing a lot of work in the background, a hell of a lot of amazing work medically and legally. Where do you see this going, hopefully, in the United States, obviously, as you can speak solely on behalf of them at this stage, over the next couple of months?
Right. Well, so in the United States, I'm working with a very specific group of attorneys that I've already written the foundation complaint to be used with the applicable plaintiffs, the people that have been harmed by the vaccine or by the infection, that we are getting those individuals lined up to file federal cases. The key to every one of these cases, both in the United States and in the International Criminal Court, is the gain of function research. Right. I have repeatedly and I've really kind of had to drive the point home, and sometimes it's uncomfortable for people, said, judges do not care whether you're being vaccinated. Judges do not care if you're being forced to be masked. Judges do not care if you're being quarantined. Judges do not care if you're being deprived medical care. They don't, because they feel, I think, immune to that. They feel like that just doesn't affect them. And until it touches home to them, they're not going to listen to something that's very uncomfortable, particularly if there's somebody out there really trying to regulate what's going on. But what they do feel uncomfortable about is that recognition that something was made, intentionally made, that is harmful, that isn't necessarily designed to kill you now, but is designed to have a slow, smoldering effect, causing neurologic and inflammothrombotic diseases in your body. And if you don't do something about it, will continue to progress. And I think that is the only thing that is going to get their attention. And that is what we have seen is getting the attention. And all we need is one honest judge left in the system. And, you know, I don't know why I thought of this. It's almost like the Bible. If I could just find one. Sorry about that, folks. It just hit my brain at the time. You know, I don't know as we're going to find 10, but maybe if we could just find one. Just one, that's all we need. Because then it can't be turned back. We just need, on the International Criminal Court, I think that's always a tribunal, we just need 2 of the 3 judges to be honest and to accept reality. Now, I'm going to go for all 3 because I'd like to think at that level that maybe we still have, of the group of judges that are on the ICC, that we still have 3 that would be honest, that would come together and hold these people accountable. If we do not hold those people accountable, I think we've written human history, but not in a good way. Yeah. Because they did not stop with the development of SARS-CoV-2. And they clearly have not stopped since. Every time something's been raised, the ante has just been increased. You know, they have doubled down. You know, I knew when Robert Redfield stepped out of the CDC and went on television and said, I'm no longer head of the CDC. I cannot tell you what I know, but I am, after all, still a virologist, and I will tell you that this looks to me like it's a lab origin. And immediately the response from Fauci and everybody else was, he doesn't know what he's talking about. Right. So last month, when he was still with the CDC, he knew what he was talking about. This month, when he's not, he suddenly became stupid. Yeah. You know, he suddenly lost his virology knowledge. No. You don't get it both ways. Yeah. So unfortunately, I think in the arrogance of these people, they left too much of a paper trail. And at this point in time, I guarantee you, I've sent my paper trail to enough places that it's no longer confined to anything that's just in my control. It's out there for people.
And this is exactly what we need, and this is why I wanted to get yourself on the show, and I had Dr. Ruby on. Some people might say, like, oh, well, you know, AJ, British, like, what, you know, what about British people? Obviously, I had Dr. Sam White on, who was fantastic. He left after 17 years practicing because of what he was seeing, and just the thought of them trying to, you know, inoculate children with this bioweapon, as you call it, was just sickening for him, and he rightly left. But everything has started from within the United States pretty much, and it's had a huge, massive effect on what's happening in the UK. So that's why I wanted people in the UK and my UK audience to understand exactly what level and like extremities this has gone to and where it's come from. And it's come from obviously Dr. Fauci. So when his emails were released, 3,000 plus of them, there's emails in there from him to Matt Hancock, the Secretary of State for Health at the time in the United Kingdom. So, ladies and gents, those in the UK, that's how serious it is. You've got this so-called qualified puppet master in the United Kingdom, in the United States, sorry, pulling all these strings of people here in the UK, and that's why we're going through what we're doing. So, people generally need to look outside the shores of our island that we're on right now, and pretty much imprisoned on, unless you're paying ridiculous money to get a test to test you for something that what can't even diagnose you with, so you can actually go on holiday in the first place. And this is why I wanted people to really see the bigger picture and have people like yourself on. Now, but I just touched on it there about the UK. So I don't know how much you've looked into this, but the government has set this traffic light system. So they have green countries, amber countries, red countries. So you can go to a green country without having to come back and self-isolate. You just got to do a PCR test, funnily enough, before you go. You can get PCR tests for free in any other setting here in the UK. I literally have a test centre about 300 metres away from where I live. Always empty, funnily enough. And it wouldn't cost me anything. But to go on holiday, I'd need to pay £100 minimum per person to get a PCR test within 48 hours from special companies only, before leaving and coming back as well for me and my family. So I'm looking at about £800 on testing to test me for something that I've clearly not got, and it's not going to tell them whether I've got it or not anyway, because it doesn't diagnose you.
What you need is
where, this is where like this is just that's a huge fraud in itself.
Yeah.
And unfortunately, it's what's isolating and ruining children's education all around the country as well, as I'm sure it is in America. So obviously, not only that, you then have to board a plane wearing a mask, which we know, I think there's 60 odd peer-reviewed papers. That's what I read the other day, that totally debunk masks and their uses. And I think it was at Stanford University did quite an extensive.
Yeah, there's been several mass studies. I've put a few on FlemingMethod.com. Look, if you're doing surgery, I'd prefer that you wear a mask. And if you're in a COVID ward, I'd prefer that you wear a mask. If you're driving down the car, driving your car down the road and not doing surgery, I'm not sure why you're wearing a mask. If you're driving down the road and doing surgery in a car, I'm not sure why you're doing the surgery. I understand one of the things I try to get across here is to not, that there's been an awful lot of fear that's occurred. We're going to hold an event. We're going to hold a focus group for kids, Generation Z, I guess is what it's called, for secondary school and college level kids in a couple of days. And then we're going to do a follow-up with that a week later, asking where they're coming from because of all these coerced vaccinations and masking of college students and secondary school kids in the states that are just really inappropriate. One of the and you alluded to this earlier. If you look at the people that paid for the gain of function, paid to stop the medications from being used, paid for the development of the vaccines, and you look at the names of these people, you'll find out they also give large quantities of money to universities. Again, our federal government, the Helmsley Foundation, the Rockefeller Foundation, the Arnold Foundation, the Gates Foundation, all of these people that are paying for all this also give big endowments to these universities, which is kind of a reason for these universities to say, well, okay, sure, we'll just have the kids vaccinated. What the heck? What I'm encouraging people to do now in the United States is there are some states like Iowa, Texas, Florida, where many of the college universities don't require vaccination. You know what? If you think you have to go to an Ivy League school or a California school to get your degree, you don't. Go to one of those states that don't require you to receive an experimental vaccine. It might be better for you mentally to go to a place where they actually allow you to think and learn how to think, as opposed to telling you what you should think, because the goal of getting an education at university is supposedly to teach you somewhat how to think, not how to just simply take orders. If you want to just take orders, you can go into the military. They will do a really good job of telling you how to just simply follow orders. And I have the ultimate respect. I have previous life experiences that I have the ultimate respect for military service, and everything in its due time. But to do this to our kids is just insane. Mengele has got to be rolling over in his grave right now, going, "Dang, they wouldn't have let me do this even in German concentration camps." This is the largest experimental study in the history of mankind. There's no informed consent. Everything that we did after World War II, the Nuremberg trial, the International Covenant on Civil and Political Rights, the development of the Biological Weapons Convention Treaty, the Helsinki Code for how to do research on patients, even the American Medical Association Medical Code of Ethics, all of this is being violated day after day after day. And I'm certain that the medical societies in the UK and Germany have equivalent codes of ethical research that require that patients received informed consent. And if you watch that event 2021 that we did on the 5th of June, I had people come up and open up the package inserts for these vaccines, so you could see live these documents being opened, showing that there was no information, there were no risk, no benefits on these package inserts, which means there's nothing to provide informed consent from.
Yeah, and I've actually spoke to people who have been giving people vaccines, you know, volunteers and stuff like that, and I've asked them a number of questions. Every single one, a person I spoke to has not been able to answer a single question. I've asked them, can you tell me what's in it? Can you tell me if there's any long-term effects? And can you explain to me what a spike protein is? All three questions.
Right.
Every single person I spoke to couldn't ask either any of the three. And these people are actively
injecting people.
Yeah. And you know, firstly, that is extremely alarming. But that's just a handful of people that I spoke to. I mean, there's people that are doing this all around the country. Yesterday at the Euro 2020 final, England versus Italy, which, you know, took over the whole nation.
My apologies for the loss, by the way.
All right, we're used to it. It's yeah, I wasn't holding us out for a win there. But that said, the government, in their wisdom, and all the media, straight away, bam, there's all these pop-up vaccination centres in and around Wembley Stadium. Like, come and be part of the team. You know, don't let your team down. Come and be part of the team. Get vaccinated. Like, that's what the coercion was like yesterday across media. I was just like, wow. And again, if I'd spoke to any of these people and asked them those three questions, they wouldn't have been able to answer it. But you can even go as higher than that. You know, like, I've got lots of friends who are very much in the same ballpark as me on this whole thing, and millions others now. And who spoke to nurses, people that are doing it you know, who are actual trained nurses, and they can't answer these questions, and they're just worried about losing their job and losing pay and stuff like that. And that's the you know, the horrible thing as well, is that people fear not just being part of something terrible. It's like losing their job, the money, their kids, you know, everything else that comes with that package. And that all comes down, you know, to the ivory tower. They know all this, like the SAGE group, who you'll know of in the UK, supposedly all scientists, pretty much all psychologists, and all heavily invested in the vaccine companies and pharmaceutical companies. They give all these orders down. They can see exactly who's doing what, and that's why so many management, for example, within the National Health Service, the NHS, and it's exactly the same over your version over there, turn a clean blind eye to everything, are clearly on the, like, some form of payroll. You know, there's no way they wake up in the morning without getting something put in their back pocket and make the decisions that they do. Like, no one on this planet just does that. Obviously, proving that on a mass scale is going to be very, very difficult every time. But I guess that's what the original Nuremberg trials did, didn't it?
Yes, and that's and the reason why we have the Nuremberg Code is because 7 of the doctors that were being tried in the second part of it, which was, you know, you had the original trials, but the second part were the doctors' trials. There were 11 other trials that followed the original ones. And there were 7 of those doctors who actually said, look, you can't try us for crimes. We're not doing anything different than the American doctors or the UK doctors or anybody. And they were right, unfortunately, right? That was the sad part, because experiments were going on in this country, and I'm sure in the UK, you know, on people that for a variety of reasons that, you know, really are atrocious. But there were a couple doctors there at the time that said, well, we really can't allow that to be their defense. We have to come up with some rules here that says, but these things are nonetheless unacceptable. And that's what the Nuremberg Code is. They came up with 6 or 7, and then in the end there were 10 things that came up for the Nuremberg Code. Otherwise, these guys would have gotten off scot-free. And you know, that Nuremberg Code still exists. I mean, we did not just throw this out. None of this got thrown out. You know, I've listened to people on social media say, well, Fleming, you don't know what you're talking about. Nuremberg Code doesn't have any standing for what's going on in the United States. And it's like, yeah, it does, folks. We signed this document, you know. Well, you can't take Americans to International Criminal Court. Well, that's true. You can't. However, if their bodies show up, they're there, aren't they?
Mm-hmm. Yeah, exactly.
I'm not saying how that would happen, but I'm just saying if their bodies show up, they're there.
Yeah, 100%. And in terms of, you know, unfortunately, talking about bodies showing up, there's been a lot of studies that have been coming out recently, and I've seen it on a lot of Dr. Jane Ruby's broadcasts and the show that she does some broadcasting on to do with graphene oxide. Have you looked into any extensive studies or done any work yourself on the matter? Because obviously there's videos everywhere, isn't there, on TikTok,
right.
All social media, people sticking magnets to each other, and a lot of people just say it's that, you know, it's absolute rubbish. There's no truth behind it. But now we're starting to see stories about, or reports and research about graphene oxide, which is implicating that there is perhaps some kind of truth to it. Like, if there's something that you can maybe share with us and elaborate on for the viewers to help them understand it a little bit better.
So you probably won't like my answer on this one. So to begin with, graphene oxide has been used in vaccines for some time, and we've never seen any magnetic effect from this. Graphene oxide by itself is not magnetic. You really have to triangulate it to try to get any type of electron spin to produce any type of thing. So I've looked at the study that came out of Spain, and I'm tremendously unimpressed with it. You know, I'm impressed with it, but not in a good way. It looks to me like a wet mount studies that were done by me before 2nd grade, where there's so much artifact and garbage in it that it's garbage. I had another researcher in the world, you know, scientists tend to do this to each other just like doctors do, trying to pick my brain to see what my response would be, and they sent me an email and said, well, what do you think about this? And they asked in a way that says, isn't this interesting, you know? So I was supposed to respond affirmatively, and I said, well, yeah, exactly what I just told you. I mean, it looked like somebody who was a 2nd grader did a wet mount that didn't know what they were doing and had all this artifact, and plus there weren't any of the other NMR studies or anything else that would suggest that they did any type of analysis of the chemicals to really substantiate it. And so I sent that off expecting to be criticized, and the response was, yeah, we've looked at it too, and we agree it's garbage. So we didn't see graphene oxide in the samples that we analyzed. And now that doesn't mean it's not in other samples. I mean, you know, I can only tell you what we looked at. I can only tell you my impression from that. And then my next response is, but who cares? Because it's still a bioweapon. And the point is, it's a bioweapon, not what other garbage they put in with a bioweapon. I mean, if something that causes prion disease and inflammothrombotic disease that kills people and slowly destroys their brains isn't enough of a bioweapon for you, and you have to fall back to graphene, you don't have a strong argument. Graphene's not it. They've used it for years. It hasn't produced these types of magnetic effects. Do I know what the magnetic effect is? I don't. I don't. I mean, again, I view it to the entire spectrum, from they're a bunch of nuts to it's really valid to obviously some combination of things to I don't know whether they're putting super glue on their skin. I don't know. I'm not there with them. Yeah. But I can tell you it's disturbing to look at. And the physicist in me says, I don't have a really good explanation. Now, I have seen meters be put next to Gaussian meters put next to skins on people and seen them triggered. I can't ignore that. The physicist in me goes, well, measuring device, that it measured something, you know, I don't know what it is. So I don't know, unfortunately, is the answer, but there's my spectrum that my brain's working with as I respond to that, you know.
Yeah, and you know, you said rightly so there. It isn't like the major issue here. Like it's you know, it makes a good video, but at the end of the day, the major issue here is the fact that like tens of thousands of people are dying and having major adverse reactions now, let alone what's going to happen over the next few months, based on, like you touched on there, the prion side of stuff. Obviously, I've seen a lot of your talks recently and stuff, and you touched on prions quite a lot. It's not a new thing, obviously, but from a to break it down into simplest terms, like what is a prion and why is it so significant to this these studies and these bioweapons, as you call them?
Right. So actually, there's more than one prion in the spike protein. We have, so you can think of a box. If you step on a box, you will change the shape of the box. So we have a spike protein that's typically something that's seen in coronaviruses, because when these spikes exist all around the sphere of the virus, if you just slice through it in a cross section and look at it, it looks like a crown, you know, with all the little spokes coming out. So that's how they get their name, coronaviruses. So the spike protein, we know, has inserts put into it that don't exist in other spike proteins. One is what's called a furin cleavage site, which are 4 amino acids which are put together that are proline, arginine, and alanine, which is really 12 bases. But that makes it possible for this spike protein to really increase its infectivity into cells. We know this doesn't exist in any other coronavirus on the planet. We also know that there are HIV and SIV inserts, so human immune deficiency virus and simian or ape-like immune deficiency virus inserts that Luc Montagnier's done an outstanding job of demonstrating. And since he got the Nobel Prize for discovering HIV, I think he might know what he's talking about.
Yeah.
And when you do that, those insertions in the spike protein are like stepping on that box. It changes the shape of the molecule, of the spike protein molecule. And at the top, it's produced what's called a prion-like domain. So a prion is an abnormally folded protein. And so proteins that are abnormally folded, first off, obviously can't work normally because they're abnormal. Mm-hmm. They won't do their job. But it turns out that when these abnormally folded proteins interact with other proteins, they can cause normal proteins to change their shape and become abnormal. And if enough of that occurs over time, then you develop diseases due to malfunction. And when we look at the brain, if we look at it as under the microscope, the brain looks like a sponge when enough of that happens. And so when the brain looks like a sponge, we call that spongiform encephalopathy, or sponge-like brain. And that's translated into what's called mad cow disease. You can also get other prions, abnormal proteins called Lewy bodies, L-E-W-Y, which is associated with Alzheimer's disease and other neurologic diseases. And again, I would say that, you know, Kevin McCarran in Japan, because he works with primates, rhesus macaques, probably was on top of this right at the very beginning, maybe before anybody else, where he said, wait a minute, the disease, what I'm seeing happening in American streets in the riots, this behavior of screaming and attacking people and spitting that he saw on video, you know, like the rest of you got to see on video, it looked good. I'm sure the United States looked good to the rest of the world. Yeah. It was disgusting enough being in this country watching it. I'm sure the rest of you had great entertainment value with that. Is the same thing that he sees in rhesus macaque monkeys when that part of their brain is stimulated, where these spike proteins get in and affect them. So one of his first postulates is, this looks to me like something's getting into the brain. And sure enough, they do, quite eloquently. It's been shown in the humanized mice models and in the rhesus macaque models, where these diseases develop in a relatively short period of time. So, and the other part is the glycoprotein 120 that Shi-Zheng Li talked about, which, you know, it doesn't matter how much you investigate things, there's always things that you suddenly realize that, how did that slip by me? In the 90s and early 2000s, when I was working on inflammation and heart disease and talking about red meats and how that can produce an inflammatory change, it does so by a No.5 receptor, sialic acid receptor, and ours is different than other animals. And that's why we get this inflammatory response to the red meats, or part of the reason. And it turns out that that same receptor is what the glycoprotein 120, the HIV inserts, attaches to help it bind to the ACE2 receptors. So much of the problem in my life is that I was doing research on that binding site and figuring out how to correctly find these diseases that didn't match well for the government's little plan and kind of targeted me early in life. But I'm still here alive to talk about it. Excuse me.
So with obviously the prion side of stuff and the spoke protein side of stuff, we know the potential dangers. And I had this conversation with Jamie McIntyre at the weekend and Dr. Jane before this. Obviously, you know, they've got this all-out agenda to just, you know, it's gone from here in the UK vaccinating the vulnerable to like trying to go all out vaccinating everybody, and like it's a big free for all to the point where it just looks ridiculously desperate. You've got the London, you know, the elected London mayor put it on his Twitter, offering 2 free tickets to the game last night if a Londoner goes and gets vaccinated, post it on the social media, and it's just the level of it is just like pathetic. However, do you feel, and I've heard this being spoken about a couple of times, do you think that there's a number of these vaccinations aren't actually going to be the full vaccine in the bottle? It's going to be some kind of saline and stuff like that because they don't want to harm as many people? Or do you think it is complete is what it is? And if so, if people have been double jabbed, especially because that's from what I'm reading is like the worst outcome, because I guess 2 is more powerful than 1. What does the future potentially look like, unfortunately, for a lot of people who have rushed out and at the end of the day, they've gone and done what they feel is best for them at the time. And I keep stressing this on every show. I really, really disagree with, and I'm not a fan of people that go screaming and shouting and calling people sheep for going out and getting a vaccination of something that they've personally thought is best thing for them and their family at the time. And that's obviously been the psychological warfare that's been mounted on these people from the government, is like, you need to protect granny, you got to protect the people about you. You know, the indoctrination in the schools on the kids has been just as bad in that respect. Do you think it's going to be a dark future for people that have got vaccinated through Pfizer, Moderna, AstraZeneca?
Right. So let me start off with the last thing you said, because I want to reiterate that, because it's one of the points I've been emphasizing here. If you're afraid that something's going to happen to you or someone that you love, most people will respond to that. So there's absolutely no good reason to criticize. You know, you would do the same thing if you believed that this was critical for you or someone you loved.
Absolutely.
You can't attack that. No. What you can say is, we get that. We can't argue with that. We're concerned because of, and so, you know, on FlemingMethod.com, I've got the treatments laid out that we showed that work, and I also included the treatment that I thought would be beneficial for people who've been vaccinated with symptoms or shedding. And we're in the process of looking at that in several places around the world. But I put that out there because people needed to have some idea of what to start with, treatment-wise, to give them some hope to address this. These are not people we abandon. These literally are the types of people that you want to go, we completely get that, you know, and let's turn it 180s and pretend that that was actually right, the real thing to do. Then you would want to be doing that, right? It just happens, unfortunately, in this case, we've got the other scenario. So to take that in consideration, I think that if this continues along this process, it bodes poorly for humanity, because if you give the people with this type of power the opportunity to continue to do this, they're not suddenly now going to become good people. And I think it's one thing to understand, I think, is that nobody who does something for a bad reason believes they're doing it for a bad reason. They firmly believe that what they are doing is right. You know, Adolf Hitler did not think he was a bad man. Yeah, Adolf Hitler thought he was the good man. He was saving the German people. the Nazi German scientists that were experimenting on people in the camps didn't think they were bad people. At Nuremberg, they said, look, we're not doing anything different than the rest of you. We're doing things good for the German people. So this is the same argument. And you kind of once you wrap your brain around that, you go, okay, new paradigm. Think about this from that perspective. How do we really help the most people? So and if they think that they're doing the right thing, they're not going to stop. They're going to continue and escalate it. And you can already hear that, now a third dose of Pfizer may be necessary, and the Delta variant and, and all of this information coming down. It's really a matter of saying enough's enough. Quit manipulating the system, quit manipulating the people, and quit manipulating the people that you're making afraid. That's the best message for the people that are afraid, not to harass them, but to say, it's time they quit manipulating you. It's time for them to quit making you, people quit making these people afraid. You're scaring the heck out of them. You've got the kids thinking they're going to kill their grandparents. You've got husbands and wives thinking they're going to kill their spouse who maybe has cancer or some other disease. That's the most inhumane thing that you can do to these people. Yeah. Allowing them to continue to vaccinate means you've only given them permission to inject more things and to try more things into your body. And when you've got people lining up, you made a comment about Joe Biden becoming president of the United States. It's important, if you go to the National Clinical Trials website for the U.S., that the vaccine trials for Pfizer and Moderna and AstraZeneca quit recruiting patients on the day that Biden took office, or 1 or 2 days on either side. They didn't have to recruit patients anymore. They had them.
A lot happened. A lot happened the day that he took office, really, didn't it?
Yes,
in terms of this whole pandemic. It's unbelievable, really, the way this whole thing's matched out. And you're right. And I think one of the best, we talk about, these governments have, or these people pulling the strings have obviously formulated these bioweapons in different aspects. I think one of the best weapons that we can have moving forward is unity, as in really getting people come together, whether, vaccinated, unvaccinated, show them, doing exactly what we're doing now on this podcast. And I know many others are doing it, the talks and seminars, you're doing it. Dan Gregory from the Pandemic Podcast has got a great event next week that he's streaming live called Question Everything, and it's all to do with he's getting specialists in from all around the country. It's going to be streamed live in the UK and from abroad. I think some people are coming in. So it's those type of groups, what we're doing right now, and the people watching this. I really hope that you can take advice from that respect and actually go, hang on a minute. Yeah, I'm very worried about all these people, but let's see how we can help them. Don't have to scream and shout in their face, going look at the picture of this young person who's got all these blood clots and blah blah blah. And unfortunately, I'm getting a lot of those photos and videos sent to me every day because of the nature of obviously where the podcast has gone, and I expected that, and I kind of knew that was going to happen. But like I said, from the person running this podcast, from people watch and listen to my stuff, I really encourage you to, like you just said, and give them the best hope we can moving forward, because at the minute, times are dark. No matter where you are in the world, we can only make them brighter together. That's the clear and the obvious message that I've got. I've got a question here from a friend of mine who's basically just said, look at adverse. I'll put it up here. Looking at adverse effects, the spike protein produced in the body doesn't stay in the deltoid, and we don't know how much someone makes or for how long. It's possible to become and stay attached to the ACE2 receptors, which again I've heard a lot about, causing hypertension and electrolyte imbalance that are often seen in more serious COVID. Is it something that you could elaborate on?
Right. Well, we know that the spike protein doesn't stay at the site of injection, and we know that, for example, lipid nanoparticle vaccines that contain the mRNA don't stay at the site of injection. Moderna published that back in 2017 with its lipid nanoparticle vaccine for influenza virus. And the animal model showed that the lipid nanoparticles went into the brain, the bone marrow, the heart, the liver, the spleen, everywhere. So when people are now saying, well, gosh, we didn't realize that these vaccines would go all over the body, this is where I say, wait a minute, you're the virologist and you didn't know this. I mean, the dumb cardiologist read the paper in 2017. It's your field. The spike proteins clearly don't just stay in one part; they attach to the ACE2 receptors. The question is whether what the consequence of the ACE2 receptors are. It's possible. I've not really seen data to suggest real electrolyte abnormalities or significant drops in blood pressure that are symptomatic. Usually once the ACE receptor gets triggered on the blood vessels, it has a limited response in and of itself, and your body is designed to deal with the ACE2 receptors and the opposite, the bradykinin system, which is the antagonist to that system. So it does a pretty good job in responding to that. This reminds me also of the questions that people have about sterility and those types of things. And ACE2 receptors are well known to exist on our blood vessels. And one of the next highest areas of the body for concentration are testes and ovaries, which is probably why we're seeing some of the effects, not the sensation comparison, but the fact that there's so many ACE2 receptors also on testes and ovaries. Hopefully that answered that question. For Sam, even though it doesn't look like Sam.
Is that obviously something that you could all the stories we're seeing about the menstrual cycles and the issues that women are having all over the world? I've read reports on elderly people, obviously like years past the menopause, suddenly having periods when they've been vaccinated and stuff like that. Is that very much in line with what you just talked about then?
Right. Well, remember that it's an inflammothrombotic response, like I mentioned in the theory originally in 1994. So an inflammothrombotic response in a uterus, even if that uterus hasn't been menstruating for decades, is going to produce potential blood clots, which will be released, sloughed off, and you're going to see this menstrual clotting phenomenon. Yeah.
And we're seeing it all over the world. I know. I've seen just reading through Facebook groups that a lot of ladies are in and talking about their issues and obviously giving each other support and stuff like that. It's quite alarming to say the least. So, from an outside point of view and a male, I look at that thinking, for some vaccination, it's supposed to be helping you with a respiratory disease. It's doing an awful lot of damage and mentally, emotionally, psychologically to people around the world, needlessly and dangerously.
Yeah, it's another reason why these people.
From your point of view, Dr. Fleming.
Go ahead. From my point of view, what?
Yeah, and from your point of view, moving forward, what would you like to see happen, and what would you like to see happen first in a timely manner?
Unfortunately, I think the first thing that's going to happen is the International Criminal Court. I think we're going to have a high enough profile case that stops the world in its tracks and makes everybody start to raise questions. What I'd like to see the general public do is to coalesce together, working together with this same approach that we've been talking about, and say, okay, enough of this masking, enough of this vaccination of people until we get results. And enough of this handcuffing our doctors on what the treatments are. You go to medical school to learn how to provide treatment. Governments don't provide treatment. There's nothing in the United States Constitution. I don't know if you've ever read it. Most Americans possibly have not. But there's nothing in the U.S. Constitution that allows the federal government to tell physicians or anybody else how to practice medicine. That's not the role of the federal government. So I think it's time the federal government quit playing around with something it doesn't have the constitutional authority to do, which is to tell doctors how to treat. And I would argue that for each country. So hopefully people will coalesce and work together sooner. A week from Saturday, I'm involved in an event that's in 100 countries around the world, and I believe it's called Freedom Rally 3.0. And I'm going to be the medical presenter here in the Dallas-Fort Worth area. It's actually in Fort Worth, and I guess 99 other cities in the world. And I would like to see people come out of that with a renewed emphasis on working together, securing the ability of doctors to treat patients, and to put a halt on these vaccines until we have a better handle of what's going on. That's what the general population can do, and to share that information and work together. On the legal front, what has to happen is we need to hold these people accountable in international court, to hold them criminally accountable. I'd like to see all the countries holding these people accountable in their own courts, but we're going to have to do this as a world. Like it or not, it's not just one country in this now. We're all in this. I hate to use the expression, we're all in this together, but we are. You know, I think that that phrase has been used and abused so much, it has very little meaning anymore. But either we do either stand together as a planet, or we lose everything together as a planet. And I think it's time to hold these people accountable. And they're clearly not just going to roll over and let us hold them accountable. But I think people need to realize that even if they think that they have no voice in this, that you do. That you do. I mean, we have seen this time and time again. Gandhi brought down, the UK and India. Martin Luther King brought the United States to its knees for the civil rights movement in the 1960s. People have repeatedly brought people of power to their knees by simply stating, we've had enough. No more.
Yep.
And their best stronghold over everybody was to separate people, to keep people from talking to each other, from sharing information. And what I see is that the more people talk and have information, the more they catch on. And again, like I've said before, they're not going to get a PhD or an MD or a JD out of this, but they have common sense. They know when they're being lied to. They know when they're being manipulated. And people have this intuitive, common sense approach that, as I've repeatedly said, one of the things that guides me in my life is I think when there's a question, I think, what would the smartest man and woman I've ever met in my life have to say about this? Would they say, stop and think about this? And if my parents would have said, Richard, there's a problem here, think about this, I stop and think about it. That's still my grounding, and we still all have that common sense grounding, and that they cannot beat out of us. We can give it to them, but we don't. But they can't take it from us.
Yeah, absolutely, and it goes back to this, the cliche, like, question everything. We say it all the time, and people just aren't asking themselves the right questions, and not asking themselves any questions. They're just, kind of seeing what everyone else is doing and just blindly following the lead, which is sad. And I say it all the time on other broadcasts and videos I do and stuff. I'm a big believer in, like, how you do one thing is how you do everything. You are the standards you accept, and if you allow yourself to do that and live your life by that, that's how your life will plan out. So if that's you, I suggest you get around people who just want to lift you up, see you win, and who you may be inspired to be at doing great things, because they're the best people to get around. I want to briefly touch on here, because we're talking about organizations, obviously the World Health Organization. What's your opinion on the WHO? And I guess by that, we've got that one. And can we ever get rid of them as an organization? Well, I'll just give the viewers a bit of an idea here. So the last two videos I'd done that went onto YouTube was with Jamie McIntyre at the weekend, and the one before that was with Jane Ruby and Dan Gregory. Both were removed from YouTube because Jamie McIntyre's one went against the World Health Organization's guidance on self-isolation and social distancing. And the one before that with Jane Ruby went against the World Health Organization's guidance on treatments for COVID-19, because we talked about alternative treatments, which we won't mention the name here because, again, the whole censorship issue. I can't believe we're even talking about it. So what's your views on the WHO?
Well, I guess my first response is I don't really care whether they exist or not. That doesn't necessarily mean that they're in charge of anything. The guy who's running it, I forgot his name, is not a medical doctor. So I'm not sure why you've got somebody running the World Health Organization who's not a medical doctor giving advice to people on medicine. I mean, this is like so many agencies telling people how to practice medicine. I'm really happy if you want to somehow have a group that you think you want to give a cute title to, like World Health Organization, as long as you realize that you're not in charge of anything. You know, and your opinions constantly flip-flopping, which shows that you don't have a really good, strong. I don't mind if you change your opinion on something. I just like to think that maybe you've thought it out when you keep changing your opinion. You have a solid scientific reason for doing it. So, you know, I don't lose any sleep over what the World Health Organization thinks, because it's nothing that I use as a determinant of anything. Go,
yeah.
World Health. I'm sorry. You know, it's just like, I'm sorry, who?
Yeah, exactly.
Yeah.
But I think it's because the WHO is just like they're basically used as a scapegoat and drummed into everybody about the almighty. You know, just like the explanation I get from YouTube. You know, it's very easy. I appealed to both processes and said, can you please give me the actual wording or the actual evidence against what broke these guidelines in both the videos, and they just came back with a blanket. It was just against the World Health Organization's guidelines. That was it. Like, you cannot even appeal. Like, so, and I think from a society point of view, that's all they see, whether you're in the States, UK, Australia, it's all who this, who that, who this, who that is coming from them. And like you say, it's people at the top of these organizations aren't even like in a position of qualification to even like on a worldwide scale to even talk about it. You know, when you've got people like yourself and other great physicians out there, you know, Dr. Peter McCulloch, who's done a lot of great work. He was he did a great interview recently with Dan over here in UK. And I find that quite alarming. But unfortunately, the TVs, the media, and everybody else, the BBC, the CNNs, the ABCs, and that the ones that put these people on the pedestals. You know, I've seen it on a daily basis. We see it on a daily basis here in the UK. You've got daytime TV chat shows which give time to doctors who aren't anything to do with science or medical professionals and stuff like that. You know, there's one lady who sits there, she's a nutritionist, and she just bangs on about like kids should be, you know, she might as well say they should go to bed in masks and go and shower in masks and everything else like that. She's like, she's mental. And airtime TV is given to these people every single day, as like I know it is in the States. Obviously, a lot of these media people are very much in the pockets of the governments, who are very much in the pockets of the big boys, the Rockefellers and stuff like that. Do you think like somehow trying to take the carpet out from underneath these people at the top, or cutting the head off of the snake, is like the best way to go?
Yeah, again, that's why the ICC is the way to go on this. It's to just take it down from the top on down, and it's not to leave people standing, you know, just like Nuremberg. And that's what I've asked for, is a Nuremberg 2.0. So, you know, I am clearly not the only one calling for that, but this holds accountability, and it needs to be addressed all the way from top down. And there's not a level, I think, below which we start at the top and we work our way down, and different people have different levels of culpability depending upon what their role it really is in this. But if you've been involved with this, and you've been actively involved in this, you should have a good idea of what's really going on, which means you intentionally and knowingly and maliciously, all legal terms used for a purpose here, were involved in this, all of which shows a significant criminal culpability and responsibility. And now I will go one further for you that maybe your prior guests really haven't mentioned, is that I do not believe that the death penalty is too much to ask for some of these people. Mm-hmm. These have been crimes against humanity that have killed people. Now, maybe because they got COVID and they didn't get the treatment, but these same people interfered with people getting treatment, and they have caused a tremendous amount of harm, and they have caused damage to societies and economies, and they have put societies at odds against each other, and they have caused rifts in societies, in families, in churches, in places of business, in neighborhoods, you know, in communities. This is not an insignificant time in human history. You know, people used to say, hope to live in interesting times, and the response to that was, be careful what you wish for. Well, we're in interesting times. And history will know us based upon what we do.
Yeah, absolutely. And I've said this so many times. I'm like, it doesn't matter which side of the fence you're on, or what your beliefs are, like how you reacted, what you did, and who you helped or you didn't help throughout this whole period is how you're going to be remembered. So if you want to be remembered in a good way, you know, and all the good work that you've been doing and stuff like that, like, keep doing what you're doing. You know, it's like, that's the best you can do. And just keep, you know, flying the flag for the people who just want to see humanity go back to normal in some kind of way, away from this like malicious like chaos that's being caused by money hungry, power hungry sadistics, you know, that sat in this so-called ivory tower that they've made for themselves, and they're trying to take control on. It's just it's crazy times. And do you know what, the people in the military, when I'm talking about here, all those doctors that fobbed us off with real injuries and just give us some ibuprofen and a tuba grip and said, get on with it, you guys are in trouble as well. But Dr. Fleming, thank you for taking the time out of your schedule to join us. It's absolutely fantastic. I know how busy you are. You shared some unbelievable insights, you know, medically, scientifically, to really help all the listeners. And I'm sure the ones that watch this on the replay will just be astonished by what you've shared with us today. And hopefully they can use that and maybe shed some light, best way possible for them and their families, the ones who are concerned, because they're the ones we worry about. Thank you so much for joining us today, and please keep doing the work that you're doing over there, flying that flag. Let's take these bastards down, like, you know. And I'm fully rooting for you, and I'm sure everybody else who's watching this and supports you all over the world is doing exactly the same. Honestly, thank you so much, sir.
Thank you. My pleasure.
Guys and girls, if you really enjoyed today's show, please give it a share. We need to get this out to as many people as possible. You heard all the amazing work that's being done and is going to be done in the future by Dr. Fleming and his colleagues, and myself and the people I'm speaking to at the minute. We want to help as many people as possible get through this torrid time. Okay, enough is enough. Okay, please share, please tag, and please subscribe if you haven't done so already. This episode, unfortunately, won't go on YouTube just yet because I've got a week's ban. However, it will go on my Rumble channel. It will go on Telegram. Obviously, it's here on Facebook. So just tag away, share away, and we need to get this message out to as many people as possible and just get this pool of people that want to fight for freedom as bigger and bigger as possible. Till next time, guys, take care, look after yourself, and please stay strong.